Thank you. So I'm Zulfikar Bhutta, ladies and gentlemen. I'm one of the two co-chairs of this forum for investing in young children globally. I'm from the Aga Khan University and also the SICKITS Center for Global Child Health in Toronto. It's my great pleasure to welcome you on behalf of both of us, me and Anne Maston, and it gives me great pleasure to introduce Anne, who is from the University of Minnesota and a distinguished university professor in the Institute for Child Development. And Anne will brief you on what we are all about.
Okay, thank you. The forum is an activity of the U.S. National Academies of Sciences, Engineering, and Medicine, and we're really delighted to join together with the Ethiopian Academy of Sciences to sponsor this exciting few days of taking a great look at the evidence and examples of how to invest in early child development. Could I have the next slide? Thank you. We think of ourselves as a learning collaborative, and we're so happy you can join us during these next few days. But we hope that you will continue to collaborate with us and follow the activities of this forum and use the materials that we are developing during the period of this workshop. Our vision as a forum is that decision makers around the world would use the very best evidence and science to invest in their children, to optimize not only the development of individual children in their countries and societies, but also to optimize the future of their societies that of course depends on the well-being of their children. I need the next slide, thank you. As I said, we're an activity of the U.S. National Academies, and we were organized in January 2014. About a year of planning went into this organization. We are sponsored by two of the boards of the U.S. National Academies, the Board on Global Health and the Board on Children, Youth, and Families. I'm a member of that board. I need a clicker, but we're doing this as a team here. And we have an overall objective, which you can see up here, to integrate the knowledge, the best knowledge we have on early child development and investment, and to integrate that with action in regions around the world and put it to work effectively. And we have 4 specific objectives here that you can see. And one is to explore the importance of this integrated science, which we'll be doing with you over the next few days. We want to share models with each other and with regions around the world of some of the best programming based on evidence and experience from around the world that's effective. We want to promote a global dialogue, and you're part of that dialogue for the next few days. Thank you. And we also want to generate opportunities for intersectoral coordination of both sciences and the translation into action of these sciences. We have a number of activities and methods for doing that. One of them is to convene these kinds of workshops, and we have this double workshop here this week. And from those workshops, we produce reports, and there are copies of our 2 most recent workshops out in the lobby here. But you also can download these for free on our website. And you can see many other products and activities of our workshop on that website. We're working on compiling evidence. We have videos on our website and so forth. But we're trying to create useful tools, useful ways to condense information and share it with all of you so you can put it to work. This is our 5th workshop. In the first year, we had these 3 workshops in Washington, D.C., Delhi, and Brazil. And they were on different aspects of investing in young children. In 2015, our first workshop was in Hong Kong on how do you use effectively the existing platforms to invest in children globally. And of course, we're here in Ethiopia for this very important double workshop. Our next workshop will be in Prague, and that's on children dealing with marginalization, disabilities, and children who are refugees and immigrants, and also children who face discrimination, such as the Roma children do in Europe. We like to think of ourselves as a unique learning community, and we invite you to join us in this community. We think that it's important that we're evidence-driven and informed and sharing the best evidence, but also that we are collaborative, that we're international, and that we are practical. We want the best science to be accessible and put to good use throughout the world so that we can all invest more effectively in children. And that's all the introduction I wanted to provide for you. What we want to do next is invite our co-chairs to come up and orient you to the initial part of our workshop. Our co-chairs are Gary Darmstadt, who is the Associate Dean for Maternal and Child Health and a Professor of Pediatrics at Stanford University Medical School, and also Amina Abubakar, who is a research fellow at the Kenya Medical Research Institute and also Lancaster University. Welcome.
And thank you very much for the kind introduction. I want to extend our warm welcome to everyone who is here. I particularly want to recognize our Ethiopian Academy of Science members who are here. I'm wondering if you could please raise your hand and be recognized. These were our planners, co-planners in this session. There's a number of you here. Thank you very much. We have two sessions that are going to be going on over the next 3 days. The first day and a half, we're focusing on the science and economics of family and community investments in children and their caregivers using coordinated approaches across health, nutrition, social protection, and education. I would like to recognize the planning committee that was involved. I'd just like you also to raise your hand. There are 15 members of this community who participated in putting together this conference. We're very proud that we have 75% of our speakers are from the region. It's something we really aim to do as we come to the various regions that the forum is going to over our 3 years, is to really highlight the regional issues and engage with the people in the region. In this particular meeting, we have especially tried to bring in the voices of the community into this room, which you'll be hearing from time to time since we are talking about family and community investments. I think it's very appropriate that we're here in Ethiopia to talk about family and community investments, given the strong science that we've heard about through the Ethiopian Academy of Science, and also the focus of the primary healthcare system, which is very strong here in Ethiopia on community and family care, and have done a fantastic job such that they're achieving the Millennium Development Goal 4 for child survival. Our second half of our time together will be on addressing the impacts of acute disruptions on investments in young children and their caregivers. Here we're looking at 3 different types of acute disruptions. One is human-induced, another is natural disasters, and the third is outbreaks. And we'll begin that part of the discussion tomorrow afternoon and continue through midday on Wednesday. There was a planning committee for that particular session as well that I also would like to recognize. If you could please raise your hands and be recognized. Thank you. So with that, I'd like to turn it over to my co-chair, Amina Abubakar, who will get the session rolling and start us off with a video.
So it's going to be a really brief video, which was taken in Hong Kong. Just my thoughts about what it has meant to be being a member of this forum, what I have learned, and what we hope to achieve in the next 3 days. Yeah? So these are really random thoughts. I hope they welcome. I'm Amina Abubakar. I'm a trained developmental and educational psychologist from Kenya. So coming into the forum, I was very clear about what are the contents, what are the important things for children, health, education, nutrition, But what I have learned over the last few forum meetings are to think more broadly, to question the way, some of the things we've always thought about, like, do you combine interventions? Do you integrate these interventions? To think more about financing, how is this done? More about issues on targeting and, whether the programs should be universal or more targeted to vulnerable groups. So I found it extremely useful in terms of, the nitty-gritty of how these things need to be done and the investment process that should be done at the community level. So what is exciting about coming to Ethiopia for the next session is now we are really going to move into an area that is very close to the African heart, you know. We bring our children up within a village, within a community. So now we are going to look into how do we really think through the process of enabling families and communities invest in their children. The important point I was trying to raise is that as an academic coming into this forum, I have learned to think broadly. You know, it's not just the content. The science is there that we need to invest in nutrition, in education, in social protection. What is missing is how do we invest? How do we implement? Which are the best investment points? And that is what I have learned by being in this forum. And I hope that those who are joining us in the meetings are also learning. And now we are talking about families and community, and as I've said, that is something that is very close to the African heart. So we are very happy that the forum discusses this here. Now, without taking too much time, I would like to invite members of the next session. Larry Abba, a professor at New York University, will be the moderator for this session. So let me welcome. Thank you.
Our two speakers, our keynote speakers, to come first up here, and then you'll come here. Great. Good morning, everybody. The objective of this session is to begin to define the social and cultural factors that influence investments in young children. At the height of the HIV crisis on this continent, when communities and families were sapped to their absolute lowest points many, many times, nonetheless, 90% of the burden and energy and investments in children came from families and communities. It is almost impossible to overestimate how disproportionate it is that families and communities make investments in children. Even not in dire times, but in relatively normal times. Innovations for Poverty Action recently did a scoping study of child care, early care and education in 4 cities, African cities, Nairobi, Lagos, Johannesburg, and Accra. And they found that over 80% of pre-primary age children are in a form of early education, and only over 80% of them are in private schools that are funded by the very, very meager fees of families that are very poor. Families and communities are making investments, and where better to talk about family and community investments than here on the subcontinent. We're going to talk about 2 things over the course of the next 2 days: how families and communities already invest in young children and the cultural and social factors related to that will be kicked off here on that discussion, and then how both the public sector, government, and the private sector, civil society, religious communities, business communities, make investments, and how they can support families and communities. So we're very fortunate to have 2 keynote speakers. The first is Alex Coutinho. Do I pronounce your name properly? Former executive director of Uganda's Infectious Disease Institute. He has spent over 3 decades fighting HIV/AIDS on the continent, and currently he's working with Accordia Global Health Foundation, and in that capacity addressing issues related to the Ebola crisis. And following Alex will be Jillian Melsup. Do I also pronounce your last name correctly? Welcome, and nice to meet both of you. She is the UNICEF representative in Ethiopia, and it is also impossible to understate the role of UNICEF, both globally and within the country. So we'll begin with Alex and then move on to Jillian. So please join me in welcoming them.
Thank you, and Good morning, colleagues, ladies and gentlemen. I want to begin by thanking the people of Ethiopia for hosting this forum and for inviting me to speak. And I also wish to thank the forum organizers for providing me the opportunity to give this address as I represent partly the Accordia Global Health Foundation and the Institute for Child Wellness in Africa that we are trying to set up in Malawi. By my own admission, I am not a child development expert. I am not a psychologist. I am not an anthropologist. I am not a human ecologist. And I will leave scientific studies, their design, their interpretation, and their approaches to the specialists who are in this room, and we'll be listening to a lot of that through the course of the next 3 days. Rather, in this keynote address, I wish to reflect on family and community investments from my own perspective over the 32 years that I have been working in Africa as a public health specialist and public health advocate and activist, and try to bring wisdom to the table, derived from having been born in Africa, having grown up here in Africa in a multicultural environment, and in turn, raising my own children here in Africa. For the past 32 years, I have worked as a physician and public health leader, mainly in the field of HIV, and more recently, in the field of maternal and child health. And in that role, I have encountered humanity, its challenges, its failures, and its triumphs. And in the course of researching this talk, I came to realize that in the field of child development, how much multisectoralism, how multidisciplinary this field is, and what it takes to raise a child from conception to adulthood. And the African proverb that says it takes a village to raise a child rings so true when it comes to this field. So really, this workshop that focuses on family and community is absolutely essential. And yet, when the village goes to sleep, or for whatever reason, when the village is absent, it is the family, and in particular the parents, and in particular the mother, who takes on the responsibility and lead role for raising the child. And in this regard, having done all my research over the last couple of months, I want to dedicate this talk to my 90-year-old mother, Martha Carmelina Coutinho, for what she did really to raise me. For the past week, I have been traversing Malawi, seeking support for a new institute on child wellness in Africa to be based in Malawi. And as we traveled through villages and roadside towns, the most visible population along the roads are the children, running, playing, laughing, going to school, coming from school, fetching water, fetching firewood, digging on the land, weeding, selling by the roadside, and sadly, in some cases, begging. And since I am partly in retirement, I have had the chance to travel many countries in the last few months. And in the last 2 months, I've traveled through Uganda, Rwanda, Kenya, Swaziland, South Africa, Botswana, and Malawi. And with a few variations, the picture for children is quite similar across these countries. And one is struck by how happy these children seem despite their own dire circumstances. And through my travels, I have reflected on what I will call the lottery of life, that unpredictable allocation of children to geography, to gender, to poverty, to stability, and many more external contexts that will influence their lives today and into the future. In the past, our parents and grandparents played this lottery of life by having as many children as possible, knowing that some would die and some would survive. And of those that survived, some would stunt and some would thrive. In more recent times, and especially in countries like Ethiopia, more children are now surviving. And we know what it takes to make these children survive. But we are less sure of how many of these children will thrive. And we are less sure of what it takes to ensure that these children thrive. And yet, if Africa is to take its place in the world in the future, our fundamental aim today must be not just to ensure survival, but to invest in children so that they can thrive, so that these children in turn can transform their future. So these three words, survive, thrive, and transform, become essential to our agenda as we discuss various aspects of children in these next 3 days. And so I have had to reflect on my own childhood here in Africa. And I was both unlucky and lucky. I was unlucky that my European father abandoned my mother when I was still in the womb. But I was lucky that my mother was resilient and stubborn and was educated and was employed as a nurse, and that despite the challenges she faced, she invested in us to ensure that we grew up to be what we are today. Her resilience and her investment has put me on this podium, hence dedicating this talk to her. And when I think of all the attributes that my mother gave me and the attributes that she nurtured, and I'm often asked this question. People say, Dr. Coutinho, what did your mother give you so that we can give it to our children? There are really three attributes. The first is the ability to love and to be loved. Children who grow up in hate, who view the world through a lens of hate, it's very difficult to thrive. The second was self-esteem. My mother told me I could be anything in the world. And that is an essential attribute if we are going to give our children a future view of what they can become. And the third was curiosity about all things. Curious about the world, and in particular, the gift of being able to read. My earliest memories of my mother are her reading a book to me. So, in various forms, there are several attributes that are clearly important in early childhood development. And 56 years later, I am glad that I had those few. And yet, as I reflect, all the efforts of my mother and all of my curiosity and self-esteem would have come to nothing if I had not had access to services like education, like health, and other social services that we will talk about. So fundamentally, in my view, before we define and highlight family and community investments, we need to acknowledge that families and communities, in order to function effectively, need the global community and the national and local governments to create the policies and resources that allow families and communities to also invest in their children. And in no particular order, those issues that are of a global and national level are the obvious: peace and stability, food and nutrition, health, education, social protection services, safe water, sanitation, environmental hygiene, energy, and so on and so forth. Now, these might be obvious, but clearly as I grew up as a child, Uganda had these services. And if they had not been there, my mother would have been probably too poor to have been able to send me to the good schools and to provide all of these services. So even as we think of families and communities function best where governments in Africa are supportive and are strong and are committed to investing in those key aspects that are necessary for children. And in particular, when there are shocks to the system, when there is war, when there is conflict, when there are earthquakes, when there are floods, when there is famine, when there is disease, this is when governments and the global community need to step up. So having said that, what have I distilled as key family inputs? And with my background in HIV, and having worked for in HIV for 32 years, it became very clear to me that the greatest service I could give a child was to keep their parents alive. And of course, keep the child alive. So my first sort of gem is, the key family inputs is stay alive and stay healthy, because parents are key to the welfare of their children. The second is try to rise above poverty, because poverty is a killer in so many ways. And clearly, ensure proper nutrition. Prevent illness in children. Invest in early childhood development, early childhood education, and formal education. Practice family equity. I think UNICEF has produced a report that shows how inequity at a national level and across nations, but also inequity in the home, between the boy and the girl, between the eldest and the youngest, can really undermine the gains of individual children. The other is allow a child to be a child. Play is socialization. Play is development. And yet, here in Africa and elsewhere, you also need to ensure that children work responsibly in the home and learn essential skills. And there is a debate about what is work responsibly and at what point it tips over into child labor. And we can get in that debate. But there is a level of responsible work that is necessary. And also, plan for shocks. Families, as we empower them, need to know that shocks do happen and will happen. So, as I shift to communities, it's very clear that in Africa and elsewhere, communities are key to develop the culture, the tradition, and the belonging of a child. Communities give identity, they give a history, they give a future, and they give a meaning. Communities can also act as buffers and provide resilient structures to enable vulnerable individuals and families survive. And we can describe what good communities are. We know them when we recognize them. They can function as an inclusive, supportive community. They need to be able to recognize families and individuals at risk and intervene. For me, an important part of community is to destigmatize poverty and ignorance. We often underestimate how people are afraid, and perhaps rightly so, to admit to poverty and ignorance. And they also need to ensure that culture and tradition are pro-development. And I could go on and on. But as I summarize this piece, if the starting point for me is my core business, which my core business is to keep parents alive from infectious diseases, if we keep parents alive and go beyond just keeping them alive and empower them and educate them and teach them how to be supportive parents, and then link them to national and community resources, whether these resources be culture, tradition, religion, self-help groups, microfinance, we start on the pathway of providing to these parents employment, life skills, the ability to trade, better agriculture, cash transfers, and good livelihoods, so that in turn they have the tools, they have the ability to invest in their children, to invest in health, to invest in education, to invest in their nutrition, to invest in their social protection. But beyond that, and particularly important for us here in Africa, to invest in their identity, to give us pride as Africans, to say we are not second or third class citizens or continents. And as important for me is to give our children, to inspire them to have aspirations, to be able to say that we too can go to the moon. We too, at least if we are born in Hawaii, can be president of the United States. So as I wrap up, what have I learned for myself? Because this has been a really interesting journey to come out of my sort of core area of HIV into the child space. What have I learned for myself that I would want to share with you? First is that to be child-focused, one has to be family-focused. Very difficult to focus and invest purely on the child without investing very broadly into that family. And I want to repeat that proverb, that it takes a village to raise a child. But if it takes a village to raise a child, then we need strong villages. And these villages therefore need a strong and supportive nation in order to be strong for their children. But nations themselves need to be part of a global village in order to thrive. And as we debate and agree on sustainable development goals, we hope that that global village will put us in a better position to invest further and build on the gains of the Millennium Development Goals. So finally, what do I distill as the key issues for families? In my view, families wish well for their children, but they need to be educated, they need to be empowered in the area of what it takes to have a well child. It's not obvious. They need to be helped. And they need to focus on the wellness of the child and its future, not just on the potential monetary benefits of having a child, not just on the potential social value, but focus on that child and what that child needs in a changing and uncertain future. For communities, in my view, the key roles are to help families adopt pro-child and pro-development practices. Just as there is for individuals to behave in a particular way within a community, there's a lot of peer family pressure. And so good communities point families in the right direction. But the second very important one is for communities to be positive gatekeepers for change, because change is happening every single day in Africa. But be positive gatekeepers. In particular, positive gatekeepers for change in culture, in tradition, in religion. And if I was to be asked then, what is the fundamental issue that both families and communities need to do? And that is, they must be helped to advocate for and demand their rights globally and nationally. Too often, we keep quiet. Too often, families just accept what happens to be available. Too often, communities keep quiet. And yet, we are in an era of change. We are in an era of democracy. And the true measure of democracy is whether our population and our people get the services that they need and whether their rights are met. So we need to support families and communities to be able to know what their rights are, to be able to advocate for them, and if they don't get them, to be able to demand them. I thank you very much indeed.
Demesi Hapte, the president of the Ethiopian Academy of Sciences, thanks so much for your warm welcome and for co-hosting this very important meeting. And Maston Zovuka Buta, IYCG Forum co-chairs, Gary Daimstadt and Amina Abubakar, the IYCG workshop co-chairs, and it was lovely to see the clip from Hong Kong. I've just come from being the UNICEF representative in China, and quite a lot of our staff were at that meeting, so it was lovely to see that. And to Alex Cotonou, the Institute of Child Wellness and Africa's ambassador, and thanks so much for your very inspiring speech. Ladies and gentlemen, it gives me great pleasure to welcome you to Addis and to address this important forum on investing in young children globally. UNICEF has supported the initiative since its inception in March 2013. As an active forum member, UNICEF headquarters, regional and country teams have participated in various meetings and workshops in the collective effort to invest more in young children when it matters the most. Recent advances in neuroscience show that while genes may provide the blueprint for the brain development, the environment shapes it. The brain relies on multiple experiences to develop, nature with nurture. This has huge implications for how we approach that critical early period of life. And we're just beginning to understand a new and alarming possibility, that environmental factors, including the quality of parenting, may modify the way genes express themselves, and thus may affect not just one, but multiple generations. All of this has profound implications for what we do at UNICEF. As reiterated recently at the 3rd Conference on Financing for Development here in Addis, UNICEF believes that investing in young children is one of the most effective and preventative interventions with great return for so many development challenges. As we discuss defining social and cultural factors that influence investments in young children, I would like to highlight 3 key issues that we can build on. Firstly, early childhood development is the first stage of lifelong learning and development. It lays the necessary foundation on which to build higher level cognitive and non-cognitive skills. This is accomplished through a holistic approach to children's learning and development and programmatic alignment with primary learning. One of the main advantages of early childhood development is its potential to break down inequity in learning outcomes from the very early ages by leveraging the tremendous capacity of early brain development and function. It is a critical investment that yields savings by mitigating or preventing later learning and behavioral difficulties, such as repetition and dropouts at school. It equalizes chances for all girls and boys to have a strong start. We may ask how. We are all aware that the brain develops rapidly in the first few years of life. For our discussion, let me briefly highlight what takes place in the brain of a toddler. During this critical stage, the plasticity of the brain is at its peak. Neurons form connections as fast as 1,000 per second, a process that consumes between 50 to 75% of a child's energy received from breastfeeding, responsive feeding, and micronutrients. These connections are the building blocks of a child's life, determining his or her future physical and mental health, capacity to learn, and ultimately her or his future success. Stimulation, reading with a child, drawing, talking with her, sparks the neural connections. Positive, healthy interactions, cuddling, playing games, love, reduce the impact of adversity. And protection from violence, abuse, and neglect buffers the brain from the impact of toxic stress. So in childhood development, the earlier the intervention, the better. We must also understand that science is pointing us towards a more holistic definition of ECD that includes not only education, but also health and nutrition and protection. Just as the science compels us to redefine ECD, the reality of children's lives requires us to act. Secondly, the reality of the situation is that most young children and families do not have access to adequate support to create enriched environments. ECD programs are amongst the most underfunded globally. Approximately 1 in 3 children under 5 years of age in low and middle income countries are not achieving their cognitive development potential. Globally, the gross enrollment ratio in pre-primary education is only 48%, with rates as low as 15% in low-income countries and less than 17% in sub-Saharan Africa. For example, in Ethiopia, although the country has seen unprecedented progress in education in the past decade, 66% of children between the ages of 4 to 6 do not attend a school readiness program. This shows that more than half of Ethiopian children lack vital early childhood support. Right now, the most disadvantaged children are not getting access to ECD. But if they have the opportunity to develop their full cognitive capacity, when they grow up, they will pass these benefits on to their children. Early childhood education will break the vicious cycle of intergenerational deprivation. To address this pressing issue, the Federal Democratic Republic of Ethiopia launched an integrated national early childhood care and education policy and strategic framework. UNICEF is supporting one of the major components of this new policy, the Child-to-Child School Readiness Program. The Child-to-Child approach is a 36-week program for children during the year before they enroll in primary school. The program is conducted by trained young facilitators, children in grade 5 and 6, supported by trained teachers. The overall goal of the child-to-child approach is to increase all the 3 dimensions of school readiness: the child's readiness for school, family and community readiness to send and support their children in school, and the school's readiness to receive the child and foster optimal learning environments for these young students. The child-to-child approach for the most vulnerable and disadvantaged children, the establishment of what are called O classes in Ethiopia attached to the primary schools, as well as kindergarten school, have resulted in an increase in the national ECCE gross enrollment rate for 4 to 6-year-olds from 5.6% in 2009-10 to 34% in 2013-14. However, there are significantly high regional disparities, with regions such as Afar and Somali with only 4 and 5% of the gross enrollment rate, respectively. We need to focus on future research to assess the relative effectiveness of not only different program deliveries for ECCE, but also to identify ways to scale up early learning modalities so that we're able to reach the unreached. Thirdly, the greater levels of investment and partnership in promoting equitable programs are required to harness the potential of ECD for human, educational, social, and economic development. Priority efforts should be directed to identifying and supporting the most disadvantaged and marginalized children. In Ethiopia, despite the limitations in the overall provision of ECCE, there is a general consensus that getting ready for school through the child-to-child approach significantly boosted cognitive, academic, and socio-emotional outcomes for pre-primary age young children. In a study conducted in 2014 by the University of Toronto to assess the impact of the child-to-child approach, it was found that nearly 100% of parents agreed that their child acquired skills through the child-to-child program that would help them in school. 73% of the young facilitators reported that participating in the child-to-child program improved their school performance. And I was just in Tigray a few weeks ago and actually saw some of these young 9-year-olds teaching the little ones in the child-to-child program. It was very inspiring, and just to see the pride and the self-esteem of these young facilitators and the difference they were making in the small children in their communities' lives and preparing them for school. And 74% of teachers strongly agreed that participating in the Child-to-Child program helped them to improve their teaching methodology, and 93% of teachers would like to participate in the program in the coming year. So very encouraging results so far. Between July and December this year, UNICEF will launch a new intervention, the Accelerated School Readiness Program, that builds on the child-to-child experience and offers a 150-hour school readiness program just before children enter primary school. Taking this drive forward, we need to expand resources to ensure quality and sustainability of ECD programs, because the earlier we invest in children, the greater the results will be. Therefore, we must advocate for increased budgets for early learning. In UNICEF Ethiopia's New Country program covering 2016 to 2020, key interventions in early learning will include the development and modeling of an integrated package of interventions for the holistic development of 0 to 3-year-old children. So we need to integrate our interventions across sectors: education, health, nutrition, protection, and water and sanitation and hygiene, to sustain the momentum for early childhood development in the Sustainable Development Goals. Therefore, as we deliberate today, we owe it to future generations to collectively update our thinking, our priorities and investments to meet the needs of the most disadvantaged children. UNICEF is committed to investing in the piloting of innovative approaches to address barriers and promote early learning, build the capacity of teachers, and increase the awareness of parents and caregivers on the benefit of early childhood development. In conclusion, may I wish you most successful deliberations over the coming week on supporting family and community investments for young children globally. Thank you very much.
Thank you very much, Dr. Coutinho. Alex, if I may. That's right. And Ms. Melsa, Jillian, if I may. They have been so thoughtful, rich, that we have 15 full minutes for consideration, questions from you all. So I invite questions from the floor, and I believe that somebody will walk around with a microphone. May I suggest the first 5 minutes or so primarily from forum members, and the last 10 minutes or so we'll open to everybody if that's permissible to everybody. Zulfi.
So this is for you, Alex, and as usual, very fantastic, thought-provoking, and you know, an in-depth insight into this area. So let me probe you a little bit on one of the important messages that you gave, which was the primacy of survival in difficult circumstances. And we can all understand that, given the background that many of us have on maternal, newborn, child survival. What are your views on how do we persuade governments and agencies, less so communities, because I do believe that at a family, community, village level, there isn't the same sense of doing survival first and thinking of other things later. I mean, people are also very focused on quality of life beyond survival. So how do we change the dialogue post-2015, particularly in the context of SDGs, on moving beyond survival to issues of quality of life and also issues of a long-term trajectory of outcomes and impacts, which many politicians don't necessarily understand?
So, for the last 7 years, I've been working in district strengthening programs in Uganda. And it became very clear that if districts were to be strengthened, you needed to get the politicians on board. Being able to, in my case, bring health issues into the political space became the primacy of what I needed to do if any of the other programming was going to work. It became very interesting that I started out sometimes with skeptical district politicians who quickly realized that if programs worked well, and many of these were survival programs, their vote was more or less guaranteed. I reached a point where the district leader, the equivalent of a governor of a district, said, "Dr. Coutinho, your interventions have secured my second term in office, and they became an important advocate for what we were trying to do. So how do health advocates, how do child advocates, how do survival or thriving advocates get into that political space? Part of it is very grassroots. It's what I talked about. Being able to get the population to understand what are their rights, to empower them, to educate them, to be able to demand them, so that those whose key role is to be in power, but also to deliver services so as to stay in power, understand that this is a key issue. It's interesting that in Uganda, before the last elections, when people were asked what are the most important issues that you want your leaders to do, health was always number one. And post-election, health had the least investment. There was a bit of a disconnect between those two. So how to put it on the political space and agenda is the way to go. How you do it is much trickier. But I believe that as populations get more knowledge, have a better aspiration for their children and for themselves, and this question of beyond survival starts being asked, we will see more and more pressure for leaders to be accountable to their populations. But it is not an easy journey, and it's a journey that we need to learn more what to do.
I suspect that Gillian may have a thought or two about that question, but I'm not a mind reader.
No, maybe we'll go.
Maybe we'll go to an additional question. So, Gary.
Thank you. This is a question for Jillian. I wanted to congratulate you on the school readiness program that you're introducing. And there are two main, I guess maybe two main categories of school readiness. One is on the part of the child, the other is on the part of the teacher. And I'm wondering if you could comment a bit on the readiness of teachers and how that is incorporated into your plans. It seems that as children take exams, national exams in English, it's pretty challenging for them, and one of the main factors is the teacher's proficiency in English and their ability to communicate and to teach in English. So if you could comment on that a bit.
As I said, I'm just 2 months old, so I'll make some brief comments on this. As I described in my speech, the whole concept of particularly preschool education is quite in its early stages of development in Ethiopia, and the training of teachers both for preschool children and to run school readiness programs is in its infancy. And my understanding is that UNICEF is working with the Ministry of Education to really develop the curriculum for particularly the preschool teachers. But I think the point you were making is it's also the teachers in early primary school. How are they being prepared to have these young children joining their schools? And while children go on to do their education in English at secondary school, in the early years of primary school, they're actually taught in their mother tongue in Ethiopia. And I think the whole preparedness of those teachers to be giving supportive learning environments to young children is an area that the government is working on. UNICEF and a number of other partners are working on to really improve that quality of primary school education, because I think Ethiopia has been extremely successful with getting a large number of children into school. Now it's the quality issue, because we're still seeing a lot of children dropping out throughout their primary school career. So these are big challenges that the government is well aware of, and all of the international community are providing what support we can to really look at that quality of teaching, learning environment for children. Thanks.
The issue of language diversity on the continent and its how to think about that and deal with that is enormous. So there are countries with hundreds, always scores, and often hundreds of mother tongues, and they're trying to make transitions to 1 or 2 national languages of instruction. So this is an enormously important issue that's been raised. Other questions? Joan Lombardi.
Good morning. Thank you very much for wonderful opening remarks. and for underscoring the importance of the adults in children's lives, whether they be family or teachers. I think one of our challenges that we talk a lot about here is how do we encourage coordination between health and education? And I'm wondering if you could comment on how you would think best about encouraging that kind of collaboration between health, education, and social protection. Thank you.
I think that's such a pertinent question, and as I mentioned in my speech, in our New Country program for UNICEF, we really want to be working with the government on an integrated approach to early childhood development for 0 to 3s. Having come from China where we introduced this, it is not easy, because there is generally no one ministry that is taking the role to take the lead for the 0 to 3-year-olds, and getting a number of ministries to work in a joined-up approach can be quite challenging, I think, as we all know. I think as we move forward in the Ethiopian context, we're hoping that it'll be the health ministry that will take the lead, but obviously we need that input from education, social protection, and child protection, because I think as I alluded to, and the new neuroscience brain research shows that protecting a child from violence is so key at whatever age, but particularly in that 0 to 3-year-old stage where the brain is developing and the toxicity of being in a violent situation has such a detrimental impact on that child's brain development. The research, if I can just use the China example that we did in the 4 poor counties where we've started an integrated early childhood development approach, showed that 65% of parents thought it was absolutely fine to physically discipline their 0 to 3-year-old children. Very acceptable. So changing those social norms about how you discipline a child is very, very important. And then the other issue is the whole issue of water, sanitation, and hygiene. And there's been some interesting research that we're going to try and incorporate into our integrated early childhood development. It's called Baby Wash, and it's looking at the impacts of hygiene, water sanitation, disposal of children's feces, the whole issue of children playing in the dirt and worms. How do you prevent that? How do you help parents provide a safe wash environment for their 0 to 3-year-olds as well? So it's a fascinating area, but bringing together all of those sectors is quite challenging. So I don't think I've answered your question, but alluded to some of the things that we're thinking about with an integrated approach to early childhood development in Ethiopia.
Thank you. Alex.
So I agree, it's very challenging. That's actually why we are setting up an institute for child wellness in Africa in University of Malawi, and trying to get the different colleges, education, health, polytechnology, agriculture, to work together. And in the last week, it's amazing how each brings only their lens and doesn't see the other. As an example, I was in the Ministry of Health in Malawi, where reproductive health is clearly a big issue. And I was in the Ministry of Education when we talked about the introducing reproductive health into the curriculum of school children aged 14. There's big resistance. So how do you bring those together? There's a lot more research. But also we need to get into the culture of multi-sectoral learning, because different specialities need to learn together, and then perhaps they will learn to work together and also be able to research together.
I think that the last question and responses go centrally to the mission of the forum about thinking about cross-sectoral integrated approaches, drawing on this integrated science of early development. I think the challenges associated with that are enormous. Sir.
Yes, thank you very much. I just thought I should provide some information on this topic about various sections of the community cooperating for early child development. While preparing for my contributions here, I happen to know that in Kenya, they have policy programs that are well written and articulated. And you'll be surprised that up to 10 partners are cooperating to write this, actually they have written the policy, but up to 10, I just read them to you so that you may know it is absolutely not impossible what we are talking about. Now you start from the parents and the community, the Ministry of Education, Ministry of Health, Ministry of Home Affairs, Ministry of Planning, National Development, Ministry of Finance, that is for for supporting financially and so on. Ministry of Gender, Culture, Sports and Social Services, Ministry of Local Government, Ministry of Agriculture, that has to do with food security and so on. Faith-based organizations, that create centers and to teach moral values and so on. Then bilateral and multilateral development partners. So I'm just saying that what we are saying is not impossible. And some people have been thinking about it. On each of the ministry of partners that I've read, they spell out what roles those partners are playing in an integrated way. So I would recommend that people look at this and see that it is possible for many areas, and it's the only way to solve the problems when everybody concerned cooperates. Thank you.
Thank you very much. Could I have just a show of hands about how many people would like to ask a question still? 1, 2, 3, 1, 2, and somebody else was back there. Did I see 3 or just 2? Okay, 2, I have a special presidential dispensation to go a little bit longer. President Barack Obama, Africa and America's son, has told us that we can spend 5 or 10 more minutes in this. So 2 questions. We'll begin with Madam and then go to Eben.
Thank you for the presentation. I'll just come back to the presentation of Dr. Coutinho. I think what you raise here is really critical, that your mom is an example, and it's the case of a lot of mothers in Africa. However, as we take programming and we think about program, we so much think about top-down. What are the space for family themselves, bringing their opinion? How do we not do a blanket programming? Because it's the importance of their opinion, and as you know, your mother, the way she did it, she didn't have to have external people to do it. They love their children, they want the best for them. How do we take that in account in our place? How do we take the community perspective? And I think as much as we think about it, let us more thinking about how do we take the down up instead of the top down.
So I agree. I mean, as I was thinking about and reading different pieces of research and case studies from Rwanda, from Ethiopia, I was thinking about the continent, how many countries we are, how many tribes we are, how disparate our approaches are. You know, Africa is a huge continent with hundreds and hundreds of cultures, and no single approach is necessarily transplantable from Uganda to Ethiopia, from Ethiopia to Rwanda, from Rwanda to Namibia. But there are some commonalities, and clearly we need to be able to support families, we need to be able to support parents, and they too, however, need to know what are the different inputs that make their child better prepared for the future. So that's the bottom up. Where I would disagree is that we need a much stronger top-down as well. I do not believe that families and communities in southern Sudan today, or even in Somalia, have the same advantage as families or communities here in Ethiopia or Rwanda, where there is a much stronger commitment top-down. So top-down alone will not resolve this by disempowering families and communities. But families and communities struggling on their own without support from top down is also not necessarily the best way to go.
Just to say, I think your point that we also need to be looking at the child rearing practices in the different cultural contexts and building on those, because every culture has wonderful child rearing practices. And I think as we look to develop better approaches for parents to build on what is already happening well in that community, I think is going to be very important. And with our new approach to ICD in Ethiopia, we're hoping to undertake some anthropological research first on the different cultural child rearing practices around the country and build on that.
Thank you. Ebenezer, and then Angela, and then we are finished. Ebenezer.
Thank you. I'm Ebenezer from Ghana. And lessons from Ghana with regards to school dropouts, especially at the primary level, has been identified to be the lack of attending preschools, or that's the ECD centers. So the majority of the kids also that start with the preschool centers or the ECD centers go all the way and they do very well. And the challenge we are having with the ECD centers currently in Ghana is with the inadequacy of trained teachers at the preschool level. So as you are looking at having ECD centers here in Ethiopia, you should also look at investing in training the teachers. It shouldn't be left in the hands of unskilled personnel. Otherwise, the impact wouldn't be felt that much as you are looking at investing in children to help them to survive, succeed, thrive, and all that. Thank you.
Thank you. I would like to know a little more about the children teaching children. Was that within the school hours, or was that after school? Are you seeing an impact on the children who are teaching? And also, are you thinking about including adolescents, youth, because that will give them tremendous opportunity to stay engaged in pro-social environments?
Yes, just to reiterate from the University of Toronto impact evaluation on the child-to-child, 73% of those young facilitators found that their own school performance improved from being facilitators. Those young children who are teaching the preschoolers do it after school and in the weekends. And there's a whole program that UNICEF has helped the government develop. So they have a guidebook, they have teachers oversighting them and supporting them. So I think it's an interim program until every school in Ethiopia can provide good preschool education, as is the school readiness program. It's just a transition phase. But I think your point about adolescence is very pertinent. In Ethiopia, one of the big challenges for adolescent girls is getting them to move on to lower secondary school. And learning from the child-to-child model, we really think there's some great opportunity for a kind of big sister girl-to-girl model to support young girls move from primary school into lower secondary school. So I think the model has worked very well for the younger children, and we're thinking we'd like to develop this together with the government to really support many more adolescent girls move into at least lower secondary school. Thank you.
This has been a great kickoff to what is going to be 3 remarkably rich days. I was reflecting during Alex's keynote how probably none of us are here completely by accident. You know, you said you were lucky and unlucky. We're here by accident, we're here by intention. And I think how our own personal biographies bring us to this work, Alex was able to profoundly reflect upon. The systemic nature of the challenges both Alex and Jillian raised, and we now have the opportunity to talk with each other over coffee. The coffee break will go till 10:30, I believe, is that correct? 10:35, President Obama continues to grace us with a little extra time. So please join me in thanking both Alex and Jill.